The truth is that rehab can work for alcoholism and drug addiction. There's no magic. You're gonna have to do the work on your own, but with proper support and treatment and desire, you really actually can get clean. Yeah, so I'm Josh Lichtman, and I am a psychiatrist, and my subspecialty is addiction medicine, and I'm gonna try to answer some questions for you today. How do I know when I should completely stop doing drugs? When drugs and substance abuse really take over and start to ruin your life and wreak havoc on your relationships and start to cause physical issues like withdrawal, then it's really time to consider stopping. Okay, what are some steps I should take to stop doing drugs? The steps that you should take to stop doing drugs or drinking, it's really just one and the same. The most important step is going to be recognizing that you have an issue and that your drug and alcohol use is really having a negative impact on your life and disrupting your life. And chances are that if you're asking yourself the question is, should I stop? You probably should. Can you get sober at home? And yes, you can get sober at home, and some people definitely are successful at doing it. But I think that if you seek out treatment, you're gonna find a much better, softer, more effective way to get sober, and with appropriate care and support. And this starts all the way from, do you need a medical detox from alcohol or drugs, or do you not need to be detoxed and you just need a really structured, supportive environment like a residential drug treatment facility? Or is it something that can be managed as an outpatient and you go into an intensive outpatient program? There's a whole spectrum of different types and levels of treatment to help get you clean. How does the detox process work? Detox really kind of comes down to using medical treatment and medications to safely wean your body off of substances. So we use different medications to kind of help slowly and safely get your body off of things like alcohol or opiates. And different things can be more dangerous than others. Again, alcohol withdrawal in your body coming off of alcohol is much more potentially dangerous than, for example, opiates. You may feel terrible, with both, but actually detoxing off of opiates isn't life-threatening, whereas detoxing off of alcohol is life-threatening. And the way that it works is pretty much your body is just taken through a weaning process and monitored very closely and given supportive other medications to help with that process. And then usually after you're detoxed, you're not fixed at that point. So we would really recommend going down into a lower level of care at that point to continue to address your addiction. Okay, what are some medications that can help me get sober from drugs? There's a number of medications in our arsenal that can be helpful in helping you to maintain your sobriety, and whether that's starting with detox medications or giving you medications that can help address the underlying anxiety and depression that were possibly fueling your addictions, to giving you medications that can help with cravings. There's a number of medication options that can help you on your journey. Does rehab work for alcoholism, for drug addiction? The truth is that rehab can work for alcoholism and drug addiction. There's no magic. You're gonna have to do the work on your own, but with proper support and treatment and desire, you really actually can get clean. What's the average length of stay at rehab? So the average length of stay at rehab, again, really varies. I think probably the average is 30 to 90 days, but also the average is that people fail after they leave. So it really varies. In my opinion, I think that it usually takes about 6 months in order for anything to stick. And that doesn't mean you're inpatient for 6 months, but that you're engaging in active treatment for 6 months and beyond. So YBH has a variety of options to help you, on your path, whether that be in the acute place that you're needing to be detoxed, or the not so acute place and you just need residential treatment and sober living, or if you're further along and you just need an intensive outpatient program, or if you're stable and you've been sober for years and you just need psychotherapy or medication management with a psychiatrist, reach out. We can help. We really try to cover the whole spectrum of mental health and addiction.